Hello everyone, thank you for tuning in. I am Dr. Kira and today we'll be talking about ear infections. I hope you guys grab some popcorn because we're going to do some learning. So if you guys have kids or know of somebody that has kids, it's likely that you know a thing or two about ear infections. In our country, 5 out of 6 children experience an ear infection by the age of 3. That is a huge number. That kind of puts things into perspective as to how big of a problem this is. Before we move on, I want to kind of go over a case study so we have an idea what I'll be jumping more into. So this case study is about a 4-year-old female that had chronic ear infection, strep throat on and off for 4 years, and then she also had a right ear hearing loss as well. She had swollen adenoids and asthma. She was on antibiotics this entire time, like on and off. She had pneumonia, she had asthma, she was given steroids. So the ear, nose, and throat specialist, he diagnosed her with enlarged adenoids, and they had scheduled a surgery to remove her adenoids and the tubes that were put in her ears. Her parents had decided, although the surgery was already scheduled, they decided they wanted to see a chiropractor and see if they can do anything before the surgery. So she was checked by a chiropractor, and they were given a six-week care plan. So she was adjusted, her neck was adjusted, and her back. Chiropractor also noticed enlarged lymph nodes and muscle spasms for that little girl. After 3 or 4 adjustments, the mother said that her child is a totally different girl. She seems more alert, acting more like herself. After 6 weeks, the pediatrician and the ENT noticed no signs of ear infection or inflammation that she had for so long. They had said to the mom that her adenoids were the worst that they had seen in such a long time, and when they came in after 6 weeks for the checkup, they saw that her adenoids were perfectly healthy and normal, and her hearing test came back normal too, which was amazing. And the medical doctor, he was blown away by it and totally confused and surprised, whoa, things turned around so fast. So they recommended just kind of continuing with chiropractic care and seeing that it was all obviously working. So at this point, some of you must be asking yourself, well, why do kids get ear infections? Why does my child get it? So, let's talk about that. So, children are more prone to ear infections due to the shape of the eustachian tube with the combination of drainage fluid. So, as a chiropractor, we see misalignments of the top 2 vertebrae in our spine that affects the ear, nose, throat drainage. The misalignment puts tension on some of the muscles in our neck, suboccipital muscles, cervical paraspinal muscles, and tensor villi palatini. I want you to kind of keep that in mind, that muscle. We're going to come back to that real quick. So when these muscles are tight, this decreases lymphatic drainage. All the toxins that are supposed to leave our body, that does not happen. So tensor villi palatini muscle connects to the tube, and irritation of this muscle causes malfunction, which stops fluid from draining. So this muscle is right there. So as we all already know, if there is a standing water just there, bacteria will grow. It's so easy for it to grow. We rather have moving water than standing water because of bacteria. I'm going to briefly touch on another factor. I'm not going to go really in depth with it. So there's also a nutrition factor, like eating mucus producing foods or dairy intolerance. So mucus producing foods can be like wheat or dairy for some kids, boxed or canned foods. And I'll also like to touch on natural remedies that some parents do for ear infections, like steam, garlic oil, apple cider vinegar, probiotics. Especially when the kids are given antibiotics for ear infection, we got to make sure that for the gut flora to be healthy, and because we really need that. Anyways, let's jump into some symptoms and causes. So ear infections are caused by bacteria or viruses in the middle ear, and can be very painful due to the inflammation and buildup of fluid. Cold, flus, and allergies can bring on an ear infection due to the congestion and swelling of nasal passages, throat, and eustachian tubes. So, our ear, nose, and throat is designed to drain and fight infection naturally. But if the tubes that we have in our ear, if they're closed off and they are not letting the water to drain, and it backs up because the entire drainage system of the neck is compromised or constantly having sludge poured into the system, we see the perfect environment and pond for bacteria and viruses to multiply. So let's talk about some of the symptoms that or signs that we see with a kid. So we'll see that obviously the kid has ear pain, they don't want to lay down, they don't want to sleep because it hurts to lay down. They will have drainage, or they won't have drainage of fluid from the ears, especially after like swimming and taking a shower. They're more in pain. You'll notice that they're not quite listening to you, or loss of balance, like they can't walk straight, and they also have a fever and headache. So these are all a combination of things that you can see with your child. Some of the other things to look for with the kids, especially with kids that can't talk yet, and kids that don't quite know how to say things correctly, you'll notice that they're pulling on their ear, they have difficulty sleeping, crying more than usual. Like you can just be like, hey, I know my kid does not cry this much, like what's going on? They're very moody, they're not quite responding to sounds or when you call their name, and they also have a fever. These are all signs that you can see in a child that has ear infections. Let's talk also about general route that with ear infections that most people tend to see. So when a child has an ear infection, they're giving antibiotics. They'll have a couple rounds of it if the kid keeps having recurring ear infections, and then they're recommended tubes for chronic ear infections. The tubes are put in, even then they can have an ear infection. Then after that, if their adenoids and tonsils are swollen, then they are recommended to be removed, which leads to lack of immunity, and then they easily get sick. So it's a whole cycle. So at this point, we can ask ourselves a question and be like, are antibiotics taking care of the actual problem of the water being pooled in the ear? No, it's not. Let me ask you, if your child continues to get sick, isn't that frustrating? I'm sure it is. I'm sure it is for everybody. As parents, all we want to do is help our kids. We just want our kids to be happy. So I know it's a very frustrating cycle. So typically, ear infections clear up on their own. So low intervention is often the best method for this. We're often given antibiotics, especially for infants or in severe cases, and we're also given pain meds to relieve the pain that they may be experiencing. With all of this, unfortunately, there are side effects, long-term and short-term, even with painkillers. So it's best to use them as less as possible. At this point, you're probably asking, like, okay, so why do we even have this problem? Like, where does this start? So this actually starts from birth or even before birth. At this point, I just want to say this, that what I'm about to say, like, it shouldn't be taken lightly, as well as not trying to put anybody down. C-sections are a major surgery for a mom and the baby, so it shouldn't be taken lightly. And I totally understand at times it is very much necessary for the mom and the baby to survive, and I'm not trying to put anybody down if that's what they chose or if that was the only option that they had. However, I do want this to be an open environment so you and I can have this conversation without any judgment of any sort, and I want everybody to be educated on pros and cons of going through this for our children's sake. So when the babies are pulled out from the tummy, 60 to 90 pounds of pressure is put on the baby during the C-section. This is done to get the baby out so the baby lives. I totally understand that it is important, and I don't deny the importance. But we also need to keep in mind that this is very traumatic for the baby, because normally, we hold our baby with so much consciousness, like, hey, we got to keep their head here and this and that. We try to make sure that our baby is as comfortable as possible because we know they're so fragile. So we shouldn't overlook the trauma that this causes an infant. Such force and the twist in a child's neck should not be taken lightly. Like, this is one of our patients that we have, and you can see how that poor boy was pulled out of his mom. He was just held by the neck and just pulled out. Again, I understand this was important in that moment, but again, this is why we should be checked by a chiropractor to make sure that their nervous system is working properly. So 1 out of 3 babies come to this world through C-sections in our country. That is crazy. That is absolutely crazy. Also in Nebraska, 34% of C-sections happen every year. That's higher than the national average. It's insane how many C-sections we have, and it's sad that we do, and that we have to go through this. And I also want to say this right now, that I have so much respect for every mom and every child that has gone through this, especially mothers. All they want to do for their kids, all parents want to do for their kids, is to love them, to make sure they're healthy, and all the strength and courage that you have to go through this, through pregnancy, even with or without complications. Hats off to you. You guys are amazing. You guys are absolutely amazing. So C-sections, yes, are very traumatic, but so are vaginal births. Vaginal births can be very traumatic too, because sometimes they have to be pulled out with a forceps or vacuum. That can also put a lot of stress for the mom, can also put a lot of stress on the mom and the baby, but that decreases the risk of having asthma, or torticollis, a difficulty nursing and difficulty sleeping and all of that. And this was just a side note. But let's also talk about during pregnancy, if that was like a breech pregnancy, or if there were twins, or if there just wasn't enough space, or if the baby was laying in a certain way, that can also put a lot of constraint and stress on the baby, causing an issue in the upper neck area, which can also later develop into ear infection. So let's move on and talk about tubes. So tubes are number one pediatric surgery. The national average, the cost of it is $5,700. Sometimes it's covered by your insurance, sometimes it's not, sometimes it's half of it. But your child can still get an ear infection with the tube in. Tubes are put to facilitate the drainage, the water drainage, that's not happening. So they're supposed to do that. But we are supposed to have a barrier and protecting our inner ear from the outside world. So when we get the tubes put in, we give up that barrier. And it's a temporary band-aid, essentially. However, this will not fix the dysfunction. Are we fixing the issue that we're having with the muscle there? Are we fixing the neurology there? No, we're not. All we're doing is just masking it. Another thing that we should talk about, since we talked about tubes, after tubes come removal of adenoids and tonsils. So lymphatic system is very important. It's a network of tissue and organs that help get rid of the body's toxins, waste, and unwanted material that we obviously don't want in our body. So children with ear infections tend to get swollen adenoids and tonsils when they are continuing to fight off the infection. So due to chronic ear infections, a lot of kids will get this removed. But again, are we fixing the root cause? Are we fixing the main problem of water pooling there by just removing adenoids? No, we're not. This weakens the immune system because we are removing a line of defense, which makes them more susceptible to have more ear infections of other sorts in the future. So let me take a step back now and talk about what I do as a chiropractor. You're probably wondering, why is a chiropractor talking about an ear infection? This has nothing to do with what she does. So chiropractors adjust subluxations, aka spine problems. Subluxations are misalignments in your spine causing interference in the nervous system. So our nervous system controls everything in the body. Do you agree with me? I'm sure you do. Even on the movies and the shows that they show, they talk about, oh, this person's brain dead. When somebody's brain dead, that means they can't function, they can't do anything at that point, they're done. So our nervous system is a huge deal. So when we do have a spine problem, especially in a child's neck, their immune system, especially the drainage system, is likely not working properly. Is this a big deal? I'm sure it is. It is a huge deal because there is a hindrance in their nervous system. I'm sure you probably have a question like, well, how do we get this subluxation, this spine problem? So there are 3 things that can cause it: thoughts, trauma, and toxins. Traumatic birth can be a trauma. Traumatic pregnancy for mom and the baby can be a trauma. Toxins could be eating mucus-producing foods. So that's a huge toxin. So it is very much important to make sure that your child's upper neck area is working properly, so their nervous system is communicating with the rest of the body and it knows how to take care of these little issues like an infection or whatever else there may be out there, like difficulty sleeping and all of that. So I'm going to jump right into a little bit of research, just to let you guys know there is some out there. So there's a popular pediatric doctor named Dr. Will Sears. He highly recommends chiropractic care for improving middle ear drainage and decreasing ear infections. So there was a study done in 1996. 46 children under the age of 5 received chiropractic care for ear infection problems. And research found 93% of the episodes were improved, 75% in 10 days or fewer, 43% with only 1 or 2 adjustments. That is amazing. That shows you that our body knows what it needs to do. That's what chiropractors do. We adjust and we let the body do what it needs to do, and it knows how to heal itself. And that's what the body did here. That is mind-blowing. Another case study. So this 9-year-old boy had chronic ear infection, and he had them for past 6 years. That's longer than the amount of time we're in high school, longer than the amount of time we're in undergrad. That is a very long time that this poor child had to suffer through ear infections. He had been given antibiotics for at least 6 weeks for past 6 years. That's a very long time. He had tubes put in his ears for 5 years. At this point, they were suggested to remove his tonsils and adenoids because he was fighting this infection for so long and they were super swollen. Surgery was already scheduled, but the dad decided, you know what, let's check out a chiropractor and see, if that can help him out. So he was taken in to a chiropractor, he was evaluated, and they were adjusting him. So the patient had shown amazing improvements just after second adjustment. His father stated that he was more alert and is concentrating better in school. Isn't that what we want for our kids? To be more alert, to concentrate, to learn, to grow. That is amazing. At the end of 6 weeks of their care plan, they saw that there was no more effusion in his ear. The father stated that the surgery was no longer necessary. Like, that's what his ENT specialist says. Like, they don't have to do it. And they were recommended to continue with chiropractic care. That is a win for the kid, for the child, for the chiropractor, for everybody. If we can save one kid's immune system, that is huge. That is more than what any of us can ask for. That is amazing. So, yeah, so here are some of my citations. Before I close off, I just want to say, you guys are probably wondering, why she's so passionate about ear infections. Why does she want us to understand why chiropractic plays a role in ear infections? I am a perfect example for having way too many ear infections. I had it since I was 2-3 months old until the age of 12, and maybe a couple in high school actually too. Yeah, I had them a couple in high school too. I were given obviously antibiotics and stuff. My parents were against tubes because they hadn't seen the greatest results because you could still get ear infections. I always had to carry garlic oil with me and ear drops and this and that. But as a child, I hated swimming. I hated taking a shower. I hated anything to do with water, especially swimming, because the second I swam, I always had an ear infection the day or two later, and I hated it. When I would shower, I used to tilt my head to the right so water wouldn't go in my right ear, because that was the most chronic one, although I got ear infections in both, and I absolutely hated it. Sadly enough, I didn't know what chiropractic was until I was done with high school. That's when I started getting adjusted. At that time, I had only noticed that I was doing better in school. I was more alert. I was doing better with sports and everything all around, but I didn't think about ear infections until I started swimming again, and I was like, whoa, I'm not getting ear infections anymore. Let's actually talk about like 4 weeks ago. I went swimming for 2 hours. I was taking laps back and forth, back and forth. I was a child that would never put my head under the water, but I was swimming and I was so happy, and I was like, you know what? This is the test to see, let's see if I get an ear infection. But no, I did not get an ear infection because I got adjusted, because I let my body do what it knows to do the best. Our bodies are really smart, and we need to give it credit. It's amazing what our bodies can do. So at this point, if you guys have any questions, even a small question, don't think it's a dumb question, let us know. Anything small or big, there are no dumb questions out there. Please reach out to us, send us a message, send us, stop in, call us. We're also going to be doing a Facebook Live tomorrow at noon, so please tune in if you have any questions. We'll be here to help you. And thank you again for listening. And I hope that I taught you guys a thing or two about ear infections. And if there are any questions or something that you need clarifications on, please reach out to us. Thank you so much for tuning in. Have a good night.